Facebook's messing with me. I did this earlier. I got to do it again. Um, it changed all the settings and things. It does it every once in a while. It changes the settings, and you can't find where to download to do this, to do that. So, yeah. Anyways, areca catechu betel nut. That's what I'm going over today. What is it? Let's see. Okay, medical acts also on salivary glands, serviceable in glaucoma. Areca is in use of worms and dogs, people, whatever. Also increases the amplitude of pulsation of the heart and promotes the contractibility of the intestines. So the contractibility is what moves the stool through your thing. So if you're constipated, this will bring that on. This will help that. Let's see. Yeah, worms and dogs and stuff. They got all kinds of deep stuff. The allopaths were using it for what? Something in the eye. So that's where that myopia is. Myopia is an eye problem. Okay, then the next one is argemone, sorry, mexicana, prickly poppy. Prickly poppy fresh juice is applied to ulcers and warts. So this prickly poppy juice removes ulcers and warts or heals them. Argemone mexicano has been used for rheumatic disease associated with Bright's disease or liver disease or kidney disease. I'm sorry. Kidney disease with rheumatic disease. And like sometimes you can have people that have, concomitant is skin disease with asthma. When they don't have that skin disease, it gets taken care of. They get asthma when it's pushed back in. So it's allopathically taking care of the skin disease. Now they get asthma. The asthma goes away from homeopathic medicine. They get the skin disease back, and then you finish it off with homeopathic remedy to get rid of the skin disease. Then the other one was this one's with Bright's disease, rheumatic. So this one is joint pain with kidney disease, which is Bright's disease. So they that's a relationship there. So there's a lot of relationships and different things. Like me, I've got lung issues from having pneumonia when I was young, and I also got ear issues. Is this all connected? It's a possibility. So colicky, let's see, colicky cramps and spasm of bowels, painful neuromuscular condition. So that's just nerve pain and muscle pain. Preventing sleep. So they can't sleep because of the nerve pain and the muscle pain in the nerves, whatever. Rheumatism in the left knee, stiff and painful, feet swollen, and they have a lot of weakness. And it's worse at noon as a modality. So every noon, some of these symptoms most likely come on. But they've got a stiff knee, left knee. So that would help you to distinguish it between other medicines that might be a stiff right knee, And that stiff knee can be Rus tox, can be bryonia, can be argemone mexicano. All right, and then the female, they have menses are suppressed, so they're not having their menses, diminished sexual desire with weakness. So anytime you have suppressed menses, that's a congestion down there. Something's going on. Once that's relieved, a lot of other things will get cleared up. But they have diminished sexual desire. They're not in. They don't have no desire for sex, and they have a lot of weakness going on. Throbbing headache in eyes and temples. Head is hot. Throat very dry. Pain on swallowing. So there's a lot of throat and head issues going on. Let's see. Passes less urine. So that's that kidney disease thing going on. The urine's affected. Changing color. So that's that Bright's disease. Stomach feels sick like vomiting, gripping in pit of stomach, no appetite, belching, and passing gas. So there's a lot of stomach issues going on there with a lot of gas. So those are two smaller remedies. Most likely, who knows how many times it might have been used, but like I said, they were taking everything and they were potentizing it, testing it, or proving it, giving it to a bunch of people, getting these symptoms from them and writing them down. Now, sometimes the tests aren't extensive. Sometimes it's just somebody gets poisoned by a substance. They use those symptoms and know that'll cure it, because like cures like. Anything that'll make you sick will also cure it homeopathically. That's why I say it's in the quantum physics realm, because there's no substance. It's -1, -2. When you get down to 12, I think it is 12C is you're beyond Avogadro's number of any substance in there at all. Um, so okay, as Areca, what the heck? Areca, nope. Areca catechu is glaucoma, which is betel nut, glaucoma, worms, increase of heart action. Then argemone mexicana, which is prickly poppy. So this is like the medical, the herbal scientific name, and this is the name we give it. People give it. So that Mexicana or argemone has rheumatic disease, ulcers, warts, and it's applied topically to get rid of them. But that rheumatic disease is associated with the Bright's disease, which is kidney stuff. They're colicky, cramp and spasm of the bowels, and neuromuscular pain prevents sleep. So those are the two medicines, and like I say, some of them are proven more, some of them are not, and some they just take, somebody gets poisoned by it, they know what it'll cure. So the real thing I wanted to get into is the etiology. That's as milestones in people's lives. So in other words, use me as an example. I had walking pneumonia when I was young. I threw up. I remember hallucinating, seeing green men on the curtain rods, and while my mother was cleaning up, I could see everything, but I was like delirious. I really could see a ghost-like figure up on the curtain rods. And so anyways, if I would have got like belladonna, I'm pretty sure that's belladonna. I've had a high fever, hallucinating, probably my pupils were dilated. If I'd had belladonna, that would have cut that imprint on my vital force off. But as you know, if you've watched any of these, I get up in the morning and I start coughing up some stuff. So I got lung, and I can tell, I even had COVID recently. I can tell that I have some diminished lung capacity. So I've got to work on that with me. I've got to really just sit down, take my case and figure it out. I also had, after that, I had an ear problem that they put a eustachian tube in as a child. Then later on, I had a cyst on my ear that they had to cut out in high school and put a bandage on my ear. So, these are all set up layers, if they're not treated right, like homeopathically, to discharge that off, because that's the vital force pushing out whatever it is. Wants to push stuff out the ear, wants to push stuff out the lungs, wants to push stuff out the skin, whatever that cyst or whatever it was I had on my ear. They set up layers. They can be related, they don't have to be related. So now when you go to take the case, you'll scan the life, find out what happened at times of stress. So the pneumonia, stress. Eustachian tube, there's another stressor. Uh, Cyst on the ear, not so bad of a cyst. It was cut out, but I'm surprised something didn't come back. So, and it's left-sided, a lot of left-sided ear stuff. So you write all these symptoms down, and then you look at the whole picture and you want an image of what's going on with this person. You want to get their emotional stuff, all kinds of things. So you take a big case, you scan them. You're really looking for them etiologies, them milestones, them times of stress in their life that set something up on the vital force. And then you want to know how they reacted to that stressor. Did you recover from the pneumonia? Have you, were you never well since? A lot of times you're never well since. How strong was your vital force at the time to, come on, get sick, and then push it off? Mine, I guess, was a little weaker in that area. Now you also have things that you inherited from your parents, lungs, different things. I inherited alcoholism, so yeah, all those things you inherit. And when you have a time of stressor, some people's stressor, the flu comes around, some people don't get it. Some people get it and it's not bad. Some people get it real bad. So they're the one that gets it real bad is real susceptible to that. The other one, they might have a susceptibility, they might not. Then the one just has no susceptibility. Same with giving a medicine. If I give the wrong medicine and they're not susceptible to it, then it doesn't do anything. If I want to prove a medicine by giving everybody until they overdose on it, if you don't have if you have people that are not susceptible to that medicine, it won't nothing will happen. But if you have people that are susceptible to it, so that's why you do a large group, the susceptible ones will give you symptoms, and that's worms, glaucoma, all this stuff. You'll get these rheumatic disease, you'll get rheumatism in your joints and stuff, depending on the medicine you took. Then with homeopathic medicine, unlike allopathic, they say, well, if you take this drug, this is what'll happen to you. Your immune system will burst, but your eczema will be gone. So with a homeopathic medicine, you can go in and antidote that thing. You just there's either another medicine. They say coffee does it. It just depends. You can antidote that medicine and throw it off, and the person once they give you the symptoms, you antidote it. They're better. Everything's fine. I went over one just recently where a bunch of doctors did it in a hospital in 1957. I think they said so. I think it was Germany. So in 1957, all these doctors took this medicine, 7 ladies, I don't know how many men, but they all took this medicine, the medicine that I was talking about that day. They took it and they got symptoms. They wrote them down. Now they know that's what that medicine will cure. And that's how Hahnemann started. He took cicona bark till he got malaria symptoms. That's why cicona bark is curing malaria, because it also can cause malaria malaria symptoms in a person. So once they find out how they reacted to that stressor, were they strong enough to just throw it off? Did it really imprint? What's going on there? And this, how they reacted will tell you about the miasms they have, what they inherited, from a parent, or, if they had a sickness that set up a miasm, the constitution of that person, how strong is that constitution, what type of constitution they are, the vitality of that person, how strong their vitality is, and their susceptibilities. What are they susceptible to? Allergies, sicknesses, whatever. Then it reveals also the layers. So when you find out in this time of stress, there may be 3, 4, 5, 6, 8, 10 layers in someone's life, and that reveal their when you scan all their life, their stressors in life, that'll show you where, what time in life these stressors were set up. So pneumonia for me, then the ear problems, and I still have that ear problem with the eustachian tube they put in there. What I have, alcoholism, accidents, different things throughout my life. You'd come and say, okay, what's showing now? What is the vital force showing me now? What was the last layer? From how I reacted to a lot of this stuff, I know what my miasms are, what my constitution is, my vitality, how strong that is, and what I'm susceptible to. And then I know my layers, and these are all like stories that went on in your life. I had this, I did that. Then you went your medical history. Medical history is, what you went to the doctor for, what they gave you. I'm sure my mom probably got antibiotics for the pneumonia, which, yeah. Anyways, I got a tube in my ear surgery. I got surgery on my ear and for that cyst. So these are different medical things. Different. Well, anyways, so the follow up on this is the story, the image. What is the image of this person? We always would look and say they're a sulfur, they're a calcarb constitution, and these constitutions, sulfur is like kind of dirty. They have they sweat a lot. They got dandruff. yeah, they got a certain way about them. They don't, they're not trying to be neat. They're not, calcarb is different. They're a little rounder, and sulfur's thinner. Calcarb is more rounder and plumper and jolly, and there's just, yeah. So this is how it kind of works. These are the constitutions that show up, and certain constitutions are susceptible to certain sicknesses, illnesses, and stuff like that. So this story, you're building a whole story around them. You take all these symptoms, right? And there's indirect influences, which is, let's see, like the lady in Germany. Her indirect influence was, what she didn't want to go out. Oh, you don't like to go out. I had a few medicines in mind then. Now, if I wouldn't have kept talking to her, she said, well, I go out to a doctor's appointment or something, but to go out and go shopping to make up that list, I've really got to get myself motivated. I got to encourage myself and then go shopping and do that. And oh, really, that's interesting. So when did this start or what? She said, well, earlier in my life, I was a single parent working 14 hours a day, and I had, uh, taking care of the kid, working 14 hours a day, a lot of stress there, this and that. So now it gives me that picture. This is that indirect influence coming on. Now she doesn't want to take care of anything because she's just burned out from it all. And Calcarb helped her. I don't know what she looks like. She may be a little more plump than, I am skinny. um, but that's an indirect influence. All that stress, something outward is doing that. Now, an etiology is a direct influence. Now, with her, somewhere along the way, she must have either had a husband or whatever happened. She had a divorce or a separation or whatever happened. Now she's on her own. So that is an etiology. That is a grief. That is a loss. That is a, you'd be looking at maybe, I don't know, not arm metallicum because that's a loss of money and stuff. It could be arm metallicum. There's a few of them that are for like a grief or a loss, you know. So anyways, calcarb, and I don't know if calcarb would be one, but anyways, calcarb worked for her. But the indirect is something outwardly acting upon you. The direct is all of a sudden a major situation happens, and it just strikes your vital force. Now, what he says, the first thing you always go after is the what is it? The center of, man, I forgot what CC is, but it's the center of the case. You're going for the chief complaint. The chief complaint. What is wrong? It could be that lady could have said, well, yeah, my knee is killing me, but this is what else I got going on. So then I would think, well, is the knee, if I fix up the knee, if the knee gets better from Russ Talks, Bryonia, Ruta, whatever, the knee gets better, will that clear it up? Is that the center of the thing right now? Because you're looking for the top layer. When did that happen? Oh, I just had a knee injury recently. This other thing happened back when. So then you might say, okay, well, I need to get rid of that first. Once you cleared up uh, that chief complaint, we go into the history. So now you'd be into the history, chief complaint, my knee, you've cleared that up. Now they're like, oh, that worked, man, let's go. So then you go back into the history and you find out why she doesn't want to go out. And now she didn't want to go out, but she also had a knee problem that prevented her from going out, then that knee would be the problem. So the chief complaint for that lady was, I don't like to take care of business anymore. I'm just burned out. So the chief complaint, trace it all the way back to an etiology. That is your layer. That's where your layer begin. So what happens is it just sets up a layer on you. She's stressed out, all that stress, that indirect influence kicking her butt. Now she doesn't want to take care of nothing. So you're looking for that, you're taking that etiology back and you're finding that layer. Then you find the next layer and the other layer. And, so that's why I told her, I said, listen, if you keep going, in other words, she quit taking the stuff. She said, I said, hey, how you doing? I don't know how long after it was. She said, oh, I'm about 30% better. "Oh, really?" And she said, "But I haven't taken the medicine for a while." I said, "How about we get you to 50% better?" And then I had to explain to her, "Listen, here's the deal. We get you 50% better, and maybe the medicine does stop working. We may have to go to a higher dose from a 30 to a 200C. So then we bump it up and keep working until that layer is fully discharged. Now, once that layer is discharged, all of a sudden you're going to see other things. Like I always say, if I have, I always have this shoulder pain and a hip pain, especially if I do stuff from my work I did years ago. Now, if I'm feeling those pains and that, all of a sudden I get a flu, I don't have them pains as much anymore. They're not, the vital force is focusing on the flu, not the pains, you know? So them pains are not even bothering me because my vital force is working on, once that flu's gone, now them pains come back. So that's the same thing. Once we peel off that layer of, I just can't function anymore. I can't get out and do nothing. And it's a mental, emotional, thing. It's not a physical where my knee doesn't allow me to go shopping. My mental and emotional state doesn't allow me. So once we peel that off, whether we go to a 30C and that does it, that layer goes off, or we have to bump up to a 200 or 1M, we get a little higher, and then we see that layer will discharge. That lady no longer has that situation where she can't make a go out and go shopping, make a listing, and then go shopping. You know, no longer does she have that, but now she has, like I said, maybe a knee pain or maybe indigestion or something. So now you'll see another picture come up. So you're going back through, scanning it, taking the history and finding out where that next etiology is. Once you find that out, oh, this is the beginning of the layer. This is where it started. I had a grief, or I had a injury, and also after that I always had stomach issues. I always had a knee problem or something, whatever it is. Then you got this layer, you discharge, and you're going all the way back till you get to their constitutional state where they should be. And once you get back to there, now they're healthy. We all have we all have we're basically born to die, so we're always gonna have something there because this flesh is gonna deteriorate. But when you get back to your constitutional state, you're able to be healthy, you're able to exercise, you're able to move, you can eat right, nothing bothers you, you're able to function normally, mentally, physically, emotionally. So then we go back to the etiology of each etiology, each layer, we go back to an etiology. Once one layer is discharged, and like I said, within the layers, there's, what's he call it? Layers, there's stages, yes, there's like a few stages of layers. You can, that MERS, the real prim and proper. Then they want salt, very mild symptoms, there's nothing. They want like salt. Then you get to the next NAPMER stage, and they're a little looser. They're not, they have some other things. But by the time you get to the last stage of NAPMER, this person's running around naked. They don't care anymore. So yeah. And then once you start giving them NAPMER, that run around without your clothes on goes away. Then they have the other stage come up. I can't remember what the second stage of NAPMER is. Then you get back to the constitutional part of NAPMER, and they basically are prim, proper. They just like more salt than most because NAPMER is salt. Let's see. So that's the layers. Story, looking for what influences the vital force. So in that story, you're looking for what is it that affects their vital force. Something bends the vital force till it tears. That is indirect. So with that lady, that all that stress, whatever, that the divorce or whatever happened to her, that she ended up a single parent, that was a direct in etiology that affected her directly. But now this stress just comes on, that direct one just tore a hole, a leak into the vital force, right? If not repaired, then it'll set you up for other susceptibility for other sicknesses along them lines. Anyways, The indirect is that stress every day, the same stress, 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 worry, 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 stress, stress, and it bends the vital force till it finally tears. And like I said, the shock of like a divorce or something will go right in and tear that vital force. This is direct influence. So that why does he say tear the vital force? Because that's what brings in an energy leak. And I had mentioned my my mentor. He said Robin told me he was telling us a story about a person who was a psychic and came in for something. They gave her a medicine and the psychic went away. So that was a head injury where there was a leak, and now that's what he said. She was like able to see things or whatever. And once he gave the medicine, it sealed that leak. That went away. So you can really aggravate somebody if you did that. But those leaks are the energy leaking out, whether it's pain in the knee or heart troubles or digestion troubles or headaches all the time. There is a rip in the vital force that, whether it's direct or indirect, that energy leaks out. Now, the other end is that medicine I just did where her menses are suppressed. That's a congestion. When you have a congestion, that brings on pain too. Once you get the right medicine, that menses will flow, clear up headaches and all the other stuff. So that's kind of direct, indirect, and how the vital force works. Them shocks are either a tear right like that, which is direct, and or it's a constant stressor that keeps coming in, and finally it tears. And like that lady, she's like, yeah, I just don't want to go shopping for the food or anything. So uh like I said, it's a dissipation of energy. Pain equals suffering. There is an energy leak. So anywhere there's pain, anybody that has pain, that becomes the chief complaint. That's usually the top situation because pain will cause you not to sleep, not to be able to function, not to even be able to think straight. So that can be the first layer. That could be a recent injury. That's a first layer. You go in, you hit them with a Restox, Bryonia, Ruta, whatever the injury is. Arnica could do it, and you peel off that first layer and they come back, they'll say, hey, yeah, I'm better, my leg's better, my knees better, whatever's better. Then you can go deeper into their history. Then you can go down in and start, you know uh, they're more open. Number one, they, because most people are like, homeopathy, ain't gonna do nothing. Then you hit them with something and they're like, holy crap, I can't believe that worked. The symptoms are the expression of the vital forces disharmony. So we think the symptoms are, oh man, we got runny nose. I got to stop that. No, you stop that, you're pushing the disease back in. The body's trying to push it out. Oh man, I've got um, diarrhea, always got diarrhea, and I've got to stop that up. No, you got to figure out where that's coming from. And because the body, the vital force is trying to say, let me get this stuff out of here, out of the nose, out of the vagina, out of the anus, out of the skin, sweat, pustules, warts, whatever comes out, a cyst like I had on my ear, whatever needs to come out, the body is going to push that thing out. So uh, that's the disharmony in there. The energy flows through the body like the blood. It can be obstructed and congested too, just like I said. It's either a leak or it's a congestion. And like in uh, shiatsu is pushing hard, like I pushed on my wife's neck last night because she had a terrible headache and I relieved it. So there was a congestion there. I got rid of it using shiatsu. Context of symptoms. How clear and intense, whether mental, emotional, or physical, whatever the symptoms are, how clear are they? How intense are they? Or are they just there, and it's this other thing. It's this pain in the knee, and they're saying, man, I got, my emotional state is so bad and I can't get nothing done in that. But the whole time you clear up the knee, now they're able to get up and do it, and they're able to sleep and get things done. That was the center of the case. So and the context is you're bringing what's going on around. You're getting the context from the whole story. Context is the big thing. Analyze the state, the location. So the state, what kind of state are they in? Are they depressed? Are they up? Are they weak? Are they strong? What is the state they're in? Location, where is it? Organ. What organ is it affecting? The kidney, whatever. Tissue, what tissues are affected? The muscles, the nerves, what system, the blood system, the nerve system, the sensation. What does it feel like? The modalities. What makes it better or worse? Concomitants is like the last one. The kidney disease is related to rheumatism. Etiology, where did it start? What was there, an accident, an injury, a grief, or what was it that started that? The pathology, which is the medical stuff. So that's clams. Concomitants, location, etiology, modalities, and sensation. You're finding all these things out. You're scanning the whole thing. You're finding the chief complaint. You're going in, you're hitting that chief complaint. Once that layer peels off, find the etiology. Where did that chief complaint start? You peel that layer off, you'll see another layer underneath, and you just keep going until you get down to the constitutional level of this person. Now they have health. All right, that's morning medicine. You can age, but you don't have to get old. I hope I can get this into my thing. Last time I couldn't, I had to do it a second.